Okay, so please describe where your pain is.
Should we get a hair tie?
And actually, do you have a hair tie or someone has a hair tie? And I just want to refresh my hands. Is there sanitizer?
Yes, Thank you.
Is there? Oh yeah. I just want to just between patients, I like to refresh my hands. At least refresh that. Okay. Okay. Good. So please describe to the class where your pain is, or show where the pain is.
It's here.
Oh, on the left. Okay. Tell me, class, where is the point channel that's sick? Okay, thank you. Yep, okay. That looks like it. Yep, okay, you can have a release. Right, because GB would be here. You don't have me here. But you're saying it's in here?
Yeah.
So I'm going to start at 20. And then I'm going to move slowly along the bone. I'm moving along the border of the bone. Oh, yeah. Oh, yeah. And now I'm on bladder 10. It's definitely more ropey than her right side. Right in there. So when I rub along there, what is that? Discomfort out of 10. I always say discomfort. You know why? Because some people don't describe it as pain.
5.
5 when I was pressing on it with that pressure? Okay. One other person that has not palpated that doesn't mind being on face, just to feel the tissue difference. Anyone that hasn't? Emma, sure. Is she finding the spot?
Yeah. Just,
Do you feel it?
Just there.
Compare both sides.
Just there. Yeah.
Good. And can you compare both sides and describe to the class in your words how it feels?
Just feels like that's the spot there.
That's it.
Just feels just tight, like a nut kind of feeling underneath.
This one also felt almost a little more ropey. Like a very tight band. And she's pressing with the same pressure?
Yeah.
And so you're getting what out of 10?
Oh, that's a bit stronger. So yeah, I would say 5, 6.
5, 6. Okay. Okay, so bladder is the sick channel. Foot taiyang. Now we're practicing system 3. What's the balancing channel? This should Foot Shaoyan kidney. This should be the easiest one for you to memorize because you've already spent how many years memorizing it? Right? Bladder, kidney. Great, great. Okay. We could have you, let's have you lying down. And what side am I treating? What's the side with the sick channel? Correct. So contralateral, right side. Correct. So I always first palpate. Because if there is a tissue abnormality that's reflecting the sick area, I want to go right at that spot, especially if I have time. Okay? So I always compare as well. I always like to compare sides. So let me start here. So I'd like for you to flex your toes up and now relax. Perfect. Okay. So bone sitting on the neck, that's the joint line. I'm going to start right at the joint line. And that's okay for you?
Yeah, I probably do feel a bit more on my left side at the moment.
Okay, and the sick area was your? Yeah, it was your left. So we're looking for right side. That's okay. I'm going to just compare one at a time here. And if I go towards the bone here?
Yeah, there's more sensation there, definitely.
And then here? What about here? Right below.
Yeah.
The reason why I went there is because there's
waking up.
There's a little bit of so if you can see from the camera, I went here, and then I went up, and there was just a little, let's call it another little tiny speed bump. It's like a little mat that just pops up. So I'm just checking here. Here I'm at the joint line, which is basically where the bone would be sitting on the head, like about C1, C2 I should say. And then here I'm moving up. Not quite the same. Not quite the same little bump, which is what I would expect, right? So here, yeah, there's something right here that's happening. So which is happening right at her bladder 10, which is just underneath the bone, where the bone is sitting. So Emma, I would like you to come back and compare both sides. Okay, so you're going from here, from kidney 3, you're going up here, you're going to feel where there's some tissue change right there. And you're going to compare that same to the other side. Let her know if she's got the spot or not. Pressing too hard or too light?
No, it's just at the base of where you're pressing is where it is, just at the bottom end of that
do you feel that change there?
Yeah.
I think you're right there, yep. Now check on the other side, the same place and process.
That's the area.
Yeah, like right there, hey?
Mm-hmm.
Yeah. Is it uncomfortable for you?
No.
Okay, but you notice it's different.
Yeah.
Same pressure, same placement. Can you find it?
It's fairly similar,
I can definitely feel it.
but
just
there's
here.
definitely more
Yeah.
becoming apparent.
So for you as the clinician with your hands, are you feeling
I
that?
don't really feel much here.
Yeah. Okay, so I'm just having her confirm. She cannot feel that same on the right, on the left side than she does on the right, which is what we're doing. We are going to go on the right, but it's just I'm trying to give you some validation and confirmation of what we're doing here, and what's happening in the body, and how these channels are reflecting everything. Okay, let's do it. Okay, I'm going to start with that spot right in here. You ready here? Woo! I did. I felt a little pulse go up through my finger here. So I just took a pause. See, so sometimes patients won't feel that. You still have to go by your feedback. Okay, but you didn't feel anything? That's okay. I'm just palpating because I want to see if I've gotten all the tissue. I could re-angle. There's a lot of tendons and nerves around here. I'm just going to put one more right beside it, and I'm going to angle into that epicenter. That's also what you can do also.
Excuse me, Sonia, is your first needle directly in the center? Or?
Pretty much I aim for directly in the center for this one, yeah. Okay, so I want to go on the edge here, and I want to angle down in this way. Are you feeling that?
A little bit, yeah. It's a little bit sharp. But it's
And
not-
this one, the first one was more. Or you didn't feel the first one. I felt the first
No, I
one.
didn't feel the first one at all.
Yeah.
The second one I did. Yeah.
Good. And I felt the first one. It went up through my finger. And she felt the second one more. That's okay. That's good enough feedback. So now let's double check. I'm not sure if I want to come up higher where it goes up where the bone is, the head is sitting on the head. I'm going to check first, and I'm going to decide if I want to add one more.
Oh, so is
Okay.
that more the actual subocciput area at the closer to the heel or not?
Not quite. No, we're not quite.
Anatomically, I mean?
Yeah, we're not quite on the heel. We're not quite on the heel. So we can check towards the bony part. Where right now, when I felt the rope, it was off the bone.
Yeah.
If we went up on the occiput and it was going to be on the bone that she was feeling, then I would go up this way on the bone here. Got it? But for her, when I was palpating it, the ropiness was not on the bone. I could check and see, but I palpated and it was distal. It was inferior to the bone. All right, so let's go back and find 20, and then we go to 21. Sorry, to 10. So, Do you feel any discomfort? Right now,
No.
I'm going right along 20. Now I'm going towards 10.
No.
What we could do is we could have her sit up and try and find it in the same position. Because we only have it in her ankle. Let's see if you need help. You're good? Good. Okay. Emma. Just use the same pressure. Can you find it? Can you feel it?
No.
No.
Disappeared. Emma,
It's gone.
say it louder.
It's gone.
And the patient feels that it's gone, yes?
Yeah.
It's gone.
Yeah.
2 needles, 2 seconds. The beauty of balance. Amazing, right?